let's get rid of that thing.
Game night at the Gudenraths.
All right, I can do that.
And Dad is on a roll.
Uno and blue.
This is a family that likes spending time together.
Green.
But for as long as Mike can remember, he just didn't have the energy to do it.
It would start on the way home from work. I would just be dragging. Didn't want to do anything. I can play that again.
Once Mike hit the house, it was lights out.
And I would literally be asleep an hour after I got home.
This went on for years until a health scare unraveled the mystery.
And these little episodes started where I'd be just sitting and the heart would start beating really, really hard to a point where you could almost see it, my whole chest was jumping. And then I'd get real clammy and hot and sweaty, and it would last about 10 to 15 minutes and then go away.
A trip to the Allegiant Health Lakeside Emergency Department ruled out what Mike feared, a heart attack. A series of tests would prove even more frightening.
I remember when the doctor came out and said he has at least one hole, are you sure you have the right patient?
Mike actually had 3 holes in his heart.
One of the holes was measuring 28 millimeter, which is 3 centimeter.
That's larger than a quarter. The holes are usually detected in children, but Mike was 48, and the fix would be anything but routine. A friend recommended Allegiant Health Clinic interventional cardiologist, Dr. Himanshu Agarwal.
What I told him is, let's try to fix it without open heart surgery.
The Allegiant Health Clinic heart and vascular specialists pride themselves on taking complex high-risk cases and providing care few can. On June 10, 2011, Dr. Agarwal set out to plug the holes in Mike's heart by inserting 2 large devices through a tiny hole in his groin.
Then we use a sizing balloon. Now, just like a balloon, we go there inside the hole, blow up the balloon with saline, and try to size it to see exactly how much big these holes are.
The device is permanent, so it has to fit just right. And unlike open heart surgery, patients like Mike go home the next day feeling like $1 million.
It's just nice that he's not always sleeping.
Your turn.
He actually asked my daughter and I to go shopping the other night, which really was not like him. So, yeah, it's been very nice.
No yellows? I feel like I cheated him. You know, I feel like I've let him down in a way because I was so stinking tired and lethargic and uninterested in doing stuff. I just didn't have the energy to do it. Now I've got it, and it's fun, making up for a little lost time. Perfect! Winner!
Thanks to Dr. Agarwal and his team. If you would like more information on the Allegiant Health Clinic heart and vascular specialists, or to find a physician who is right for you, call 1-800-ALLEGIANT or go to allegiant.com. With your health news, I'm Mary Williams.